Good afternoon. Thank you for joining us for today's webinar. My name is Nastasia Walsh, and I am the Associate Program Director for Justice at the National Association of Counties. I'm going to be moderating today's webinar. Before I begin, I'll go over a few technical details to ensure everyone can view the webinar correctly. This webinar is being recorded, and we will post it on the Stepping Up and Data Driven websites for future viewing. You will also receive an email tomorrow if you registered with the link to the webinar recording. Also, to the right of your screen, you'll notice there's a control panel, and in this panel, there is a questions box. You can use this box to type in questions at any time or send us a message if you're having any technical difficulties. If you're having technical problems, we'll respond to you privately to help resolve the issue. And then during the Q&A session at the end of the webinar, I will read the questions on your behalf. So feel free to start sending in questions as soon as you have them during the presentation. If you want to have a better view of the presentation, you can click the small orange arrow in the top left corner of your screen. So we have a very exciting webinar today for you guys. Many of you are familiar with either the National Stepping Up Initiative or you're familiar with the National Data Driven Justice Project. We know that there's a lot of you who are part of both or familiar with both and really see a lot of similarities in some of the challenges that you guys have been talking about, especially related to data, information sharing, and so wanted to have this the first of two joint webinars on this really important issue. So I want to take a minute just as we're getting started to talk about what these two different initiatives are. And that way, everybody has a little bit of background on both of these before we jump into our speakers. So first is Stepping Up is a national initiative to reduce the number of people with mental illnesses in jails. Stepping Up is a partnership between the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation. Stepping Up launched in May of 2015, really as a way to elevate this issue at the national level and to encourage county leadership at the local level as part of this. So since we launched, more than 500 counties have passed a resolution or proclamation committing to being part of the National Stepping Up Initiative and to creating systemic and strategic plans at the local level to help address this issue. These 500 counties are in 43 different states across the country. Almost half of all residents in the United States lives in one of these counties. So we're really seeing a big impact here. We have 15 and going on 16 innovator counties who are really shining on the data collection piece. You can find out more about them on the Stepping Up website. And we have seen more than 10 statewide Stepping Up summits. So some of you may have attended some of those within your own states as well. Also, just so you guys know about the resources that we have available, we do have regularly scheduled webinars like these. Anybody is welcome to join those. We also do educational workshops at NACO conferences, at conferences of our national partners like the National Sheriff's Association and NAMI conferences. We also do quarterly calls of our rural, mid-size, and large urban counties. And these are calls that are only open to counties that have passed a Stepping Up resolution. It really gives an opportunity for these jurisdictions of similar sizes to network with each other and learn from each other. So if you are not part of those and your county has joined Stepping Up and you're interested in joining those, please just shoot me an email after this call. We also have a project coordinator handbook to help jurisdictions get started with some of their Stepping Up efforts. We also have an online self-assessment tool that counties can use. It's all on the Stepping Up website, so stepuptogether.org. With the assessment tool, you can identify where your county is in terms of the recommended actions and framework of the Stepping Up initiative. We also have tons of case studies and issue briefs up on the Stepping Up website to help you with your efforts. So definitely recommend that folks check out the website and the resources there. And if you're interested in the 15 Stepping Up Innovator Counties on the website, if you go under the counties, there's a tab for Innovator Counties, so you can go see what those 15 counties are. And also see how you can become a Stepping Up Innovator County. We'd always love to grow that network of folks. So I know that's a very, very quick overview of Stepping Up. Definitely encourage you to go check out the website. The website's right there on the screen, stepuptogether.org, and then the contact information from the 3 partner organizations that are part of Stepping Up are up on the screen as well. So please feel free to reach out to any of us if you have questions or you're interested in becoming a Stepping Up County or interested in becoming an Innovator County. We are always here to help. And now I'm going to turn it over to one of our really strong partners in Stepping Up, Maria Fryer. And Maria is the Policy Advisor for Substance Abuse and Mental Health at the Bureau of Justice Assistance at the U.S. Department of Justice. And she's going to talk a little bit about BJA's interest and support of Stepping Up and any new resources that they have. So Maria?
Great. Thank you so much, Nastasia. Hello, everybody, and thank you for having me today. Just to say hello and let you know that BJA supports the work that you're doing through Stepping Up and data-driven justice. And data is so important and a great priority in how we use it and apply it. And we've learned so much through all the work that you do on a daily basis to inform our programs and policy work. And what you gather and learn from collecting and analyzing your programs helps us to move the entire field forward, and we are grateful to all of you. BJA's learned through our grantees and our training and technical assistance engagements that still a significant number of people with mental illness cycle in and out of jails in most local communities and counties across the United States. And we know that it will take a multi-pronged approach that involves planning, training, and thoughtful policy and practice involving many community service providers to reduce the number of people with mental illness in jails who might be better served by community treatment and other wraparound services when appropriate. And through Stepping Up and the Data-Driven Justice Program and other programs in partnership with BJA, we hope to make a positive impact on this problem through the use of data and careful planning to inform decision making. And so we're really grateful to have all of you on the webinar today. You know, so we think about this problem, what BJA's done so far to try to impact the problem. BJA has supported the work in several areas of practice within the justice and behavioral health system. One is through the Justice and Mental Health Collaboration Program. We've supported programs and policies that create system-wide change to enhance county collaboration, police responses, court processes, and correctional treatment of persons with mental illness in custody settings. And of course, there's other initiatives that BJA has really focused on recently. One is front-end diversion, and the other is our 10 law enforcement mental health learning sites to help with peer-to-peer learning and training and technical assistance. The development and dissemination of written materials to guide law enforcement and developing a police mental health collaboration strategy through the online Police Mental Health Collaboration Toolkit. Of course, we also have a national curriculum called Effective Community Responses to People in Mental Health Crisis that's available, and recently released a Police Mental Health Collaboration Framework document to assist leadership in policy and practice to enhance police response during calls for service. And in coordination with the Council of State Governments Justice Center, a soon-to-be-released Sharing Behavioral Health Information with Police Mental Health Collaborations. And this will be an online tool with resources and all other products to assist. So we're really excited about these new products and services that'll be available. And we've learned a lot of lessons along the way. Collaboration between law enforcement and mental health is just really necessary for successful outcomes. So thank you so much for being on this webinar today and for having me. We hope that all communities reach the capacity where they can capture and analyze key data effectively. Again, on the behalf of BJA and our colleagues today on this webinar, I want to say thank you and best of luck as you move forward with your Stepping Up and your DDJ activities. Thank you.
Great. Thank you so much, Maria. we really appreciate your support and sharing some of the great resources that are coming out of BJA, and happy to send those over to folks. If you have trouble finding them, we can share those with you as well. So thank you so much for sharing. So now I'd like to talk a little bit about the Data-Driven Justice Project. And Data-Driven Justice aims to help jurisdictions like yourselves use data to better align their responses to people who are frequent utilizers of jails, emergency rooms, shelters, and other crisis services. And Data-Driven Justice, or DDJ, is a project of the National Association of Counties and Arnold Ventures. We have about 150 cities, counties, and states that have signed a letter of interest to be part of the Data-Driven Justice Project. We are definitely encouraging more communities to join us in this effort. Communities participating in the initiative are developing strategies that promote, better outcomes for these frequent utilizers. They've committed to creating or expanding some real-time or near real-time local data exchanges that combine these health, human services, and justice systems as a way to better identify folks who are using these, better coordinate responses. They're identifying options for diverting some of these frequent utilizers from the justice system and into community-based services and treatment providers instead of jails. So we're really excited to be part of this. The website on there is on the NACO website, so naco.org/data-driven-justice. So who are some of our high utilizers? Some folks call them high utilizers, some people call them frequent utilizers, some people call them frequent flyers or familiar faces. No matter what you're calling them in your own community, these are often people who have chronic physical conditions, mental illness and serious mental illness, substance abuse, many experiencing homelessness. They're cycling sort of in and out of all these different fragmented and sporadic systems of hospitals and emergency departments, clinics, crisis centers, homeless shelters, detox centers or sobering centers, different treatment providers, as well as your criminal justice, law enforcement partners, and your jails. And so these are the folks that we're really trying to impact through the resources of DDJ. We have a number of resources available to folks up on the DDJ website. So we have a playbook that you can download that has some guidance on how to get started and some interventions and best practices in this area. We're also doing quarterly webinars to share some best practices, and all of the webinars are archived on the DDJ website as well. We host, like Stepping Up, we host educational workshops at NACO conferences and some of our partners meetings as well. We have a resource library, so you can see, case studies, different tools and toolkits, a lot of information around how to work around privacy concerns and some technology concerns. We'll also be doing virtual training sessions and workshops for some of our community leaders, and have a lot of examples of things like data sharing agreements, MOUs, business associates agreements that you might need to have in place as you're going through some of this work to identify some of these frequent utilizers and better serve people through these various systems in a more coordinated way. So the contact person for Data-Driven Justice is Sharon Ondeji. She's new at the National Association of Counties, and she would love to work with you guys and talk to you a little bit more about Data-Driven Justice. So please feel free to connect with Sharon after this webinar. And all of these slides and all of this information is going to be available on both the Data-Driven website, the Data-Driven Justice website, and the Stepping Up website. So you'll be able to download the slides and listen to the recordings later if you're not catching some of that. So I want to turn it over to our partners at Arnold Ventures. And we have Harrison Christ here today, who's going to give us an overview of our partnership with Arnold and their role in the Data-Driven Justice Project. So Harrison, I'll turn it over to you.
Thank you, Nastasia, for that excellent overview, and good afternoon to everyone on the line. Thank you for having me here. My name is Harrison Christ, and I'm on the policing team at Arnold Ventures. So before the webinar, I just want to take a very few moments to express our excitement for the future of DDJ, as well as Arnold's commitment to supporting this network of communities in their efforts to drive DDJ forward. So over the next few months and beyond in 2020, we at AV and with our partners at NACO are really looking forward to re-engaging the network and developing and disseminating resources and guides that we will hope be of value to you and your community in creating better outcomes for frequent utilizers. So some of these just include an update to the DDJ playbook, as well as some deep dive reports on innovative diversion strategies taking place across the country. So when you see emails and announcements and other opportunities to engage with us, we encourage you to reach out and share your progress and stories with us and let us know how we can best support you and your DDJ efforts. So thanks again, everyone, and I'll give it back to you, Nastasia.
Great. Thank you so much, Harrison. We really, appreciate you being on the call and appreciate your support and Arnold's support of this work and the communities that are working on it. Just a really great partnership. So thank you, guys. All right. Why don't we jump in? So we have 2 counties and a couple of presenters from each county who are going to share how they're doing some of this work on the ground. I know the number one question that I get is always, all right, but like what other counties are doing this? And so excited to have folks from Philadelphia and Pennsylvania here, as well as McLean County in Illinois. And we're going to hear first from our presenters in Philadelphia. So we have Dr. Barbara Bunkle, who is the Director of Enterprise Data Services for the Department of Behavioral Health and Intellectual Disability Services for the county. She's been with the department for over 20 years and has expertise in data systems and technology. Her experience in the data space has really helped to increase the use of current data to inform service delivery and improve quality for folks in the area. And then along with Dr. Bunkle, we have Charles McRae, who's the assistant manager that supervises the Business Intelligence Unit for the Behavioral Health and Justice Related Services Division of the Department of Behavioral Health and Intellectual Disability Services. He has over 10 years of experience in this role, and his team conducts research and analysis on internal and external initiatives to monitor outcomes and emerging trends. The Business Intelligence Unit is also responsible for designing, implementing, and maintaining the division's information management system. So very qualified folks to talk about this topic. So thank you both for joining us today, and the floor is yours.
Thank you. It is a pleasure to be with you this afternoon. So we are from the Department of Behavioral Health and Intellectual Disability Services. So a little background, if you could move to the next slide, please. So we are DBH-IDS, and that department consists of 4 major divisions. We have we have an area that does mental health for the and underinsured. We have another division that does DNA services for the and underinsured. We then have another unit that does Medicaid services that includes both mental health and drug and alcohol. And we also have a part of the department that focuses on services for people with intellectual disabilities. So we have a large area that we cover, and within these major divisions, there are some divisions that have smaller units, like the one that I'm with today, Behavioral Health and Justice Related Services. So even within the divisions, there are smaller groups within that. So what that means for us is there are lots of interactions. Lots of people are interested in helping people get services and understand what's going on. So we have lots of interactions with different units, different business units within DBH-IDS. BHJRS is a good example of that. They need to interact with homeless services, and they need to interact with residential and crisis services. So what that leads to is what you see on the screen right now. It used to be that we would have spreadsheets flying around the department. Everyone had something and they wanted to share with other people. So this is what our data began to look like. It always begins with good intentions. There are a couple of people who agree that they can share some data, but if you multiply that by a really large department, you wind up with a scene that looks like what's on the screen right now, which looks like a big pile of spaghetti. And it usually begins with an analyst or a researcher. Strategy. So if you could move to the next slide, please. So the new strategy involves data management. It's not research, it's not analysis, it's data management that needs to underlie the imperative that everyone feels to share data so they can get an understanding of what's going on. So within that spaghetti that we see up on the screen, really when you take it apart, there's a couple of areas that we can pull information and start to see some patterns. And what we can do as data management, which is a discipline unto itself, we see different patterns. So what we want to do is, starting with in the upper corner, master data. We want to get into the data and start to see there's the same people in one system and another, in one spreadsheet and another, and another, and another. So how can we bring all of these people together? So we have, sometimes we have a record for someone like Joe Smith, and then we may have something else for a Joseph Smith. Is that the same person? We can figure that out by looking at the names and a few other key pieces of information. And then once we figure that out, we can save that. So we don't need to keep that in a spreadsheet. We can store that somewhere else so we can use it time and time again. So what we do, the data management part of DBH-IDS, we try to create what we consider the golden record, which is across all of the areas, whether you're getting mental health or drug and alcohol or intellectual disability services, whether it's paid for with county dollars or with Medicaid dollars. We want to know when someone is the same person, how can we identify them as the master person, the mastered person, and keep that as the golden record. So we know that whenever we see this person, it may look like Joe, it may show up as Joseph, but it's really the same person. That becomes the golden record. But the key to that, because we have all of these other systems that underlie, we keep the lineage. So we know that Joe might have come from drug and alcohol, but Joseph comes from mental health. So we can always track back to where the records came from. But when we want to report across systems, we can use the mastered record to tie everything together. In order to do that, it's not a technology problem, and it is a data problem, but the solution doesn't lie with what we've become known as the data folks. It's really the program staff or the business units that need to step in, and when we see that some records look like they might be the same person, but we're not 100% sure, we need some data, we need some business people to help us reconcile whether these records should be joined so we understand someone's history better, or they shouldn't be joined because they're two different people. So with the wonders of technology and computers, we can set a threshold. So when a record looks identical, and we can set thresholds for what identical means, we can automatically join them together. And when a record looks like two completely different people, no doubt about it, we can keep them as two separate people. But that leaves us with a large gray area, and that's where we need our business partners to help with this process. Without them, this doesn't happen. And without the technology and the data folks, it doesn't happen either. So we need that strong partnership for this to work. We do this not just with people, but we also do it with services, because we are a large department and we have different structures. We have drug and alcohol, we have mental health. Everybody's got their own coding system for how they classify and describe their services. So again, we go to the business units, clinical staff, and the people who work with the service provision. get them together to talk about, is this service really the same? When you call it X, is it really the same as over in another area where they call it Y? Can we call that service number one? So we work with stewards to get this all straightened out, and we can master people and services. We also do the same thing for providers, for the agencies that are providing the services, because different parts of the office call the same agency by a variety of names. So we want to reconcile that down to a single agency. So that mastering of the data is that's really the most important part of putting this all together, so we don't wind up with spaghetti all over the place, but we wind up with data that we can actually use to make decisions about. So in addition to master data, we can also, when we bring the data together, we can create a record of event data, what happened when, to whom, and now we know that Joe and Joseph are the same person or not, so we know how to create a history for the people that we are providing services to. With the audit data, we're able to keep track of bits of data that transactional systems have. That gives us the ability to tie things together that should be tied together, and the ability to untie them when they should be untied. In addition to that, we have reference data, so we can talk in the same language when some people use ones and zeros for males and females. Could you move to the next slide? And the others use ones and twos or M's and F's, so we can all be talking in the same language. So really, the emphasis, what we're trying to do is really create systems where the data is reusable and not just data sharing. With data sharing, you have a few people and a few units, and they develop their own approach to this. And when they exchange data, it's hard to match up all of the unique individuals. And that when they do this, it happens over and over again. So we want to be able to leverage some automated processes and bring this together, not just for the two people who think it's a good idea to share, but to make that same understanding of who's a person, what's a service, and what's going on for people available to the entire department. So if you could move to the next slide. We spend lots of time repeating the same matching processes, and it doesn't take advantage of the automation. And that's why we'll never be able to get rid of the phrase data sharing, because it's so appealing. And whereas data reusability isn't, it's that reusability that makes data sharing worthwhile. And move to the next slide, please. So at the center, so what we want to move to is that picture that's off onto the side. So instead of a bunch of spaghetti, we want to have we want a hub and spokes coming off it, where at the center is our master data about people and services. And each division and subdivision sends data where it gets integrated all together. And what we can do with that is then create a single view of the services and the people. And that's what led to the Forensic 360 that Charles will be talking about. So if you could advance to the next slide. Our goal is to move from what we have here to the next slide, something that's cleaner and makes more sense, and not just behavioral health, justice-related services, but the entire department can take advantage of. Now, Charles can talk about what this means for him and the work that he does.
Great. Thanks, Barbara. So if you can go to the next slide, please. And the next one, please. Okay, so first off, hello everybody. My name is Charles McCrae, and I'm the Assistant Manager at the Behavioral Health and Justice-Related Services Division of the Department of Behavioral Health. And if you heard me giggling in the background like a little school kid, it's because when Barbara mentioned the spaghetti analogy, I actually lived through that and had eaten the spaghetti for quite a long time to emerge at the other end. And I can tell you firsthand that all the work they put into this was worth it. And for every person that said this is taking too long or we don't think this is going to happen, when they saw the product that we were able to utilize in the end, their attitude changed immediately. So what I want to do is talk a little bit about what Forensic 360 does for us, what it was like before Forensic 360, and how where we want to go with it in the future, and also how we utilize it internally to measure some of our initiatives. So really, Forensic 360, like Barbara was explaining, is what's called Data Mart. And what that is a view of the information that's in EDW customized for a specific audience. And that does a couple things. One, it allows us to limit access based on the needs of the end user. And also, it helps us get it past legal, quite frankly, when we're trying to open up new data sharing agreements. So in Forensic 360, what we have is we have treatment history matched with forensic history. And the way it was designed was so that if somebody had an incarceration, they appear in it, and if they never had an incarceration, they don't. And I'll get into that a little bit more towards the end of the slides. But what it really is a nexus of where all their treatment history and incarceration data meets at one. Barbara had mentioned the sources of insured and underinsured for both drug and alcohol and behavioral health issues. And having that all in one place really enables us to get this sort of macro view of not only our population, but then we can zoom down into an individual and really look and see how that person's doing across our entire system. And we're actually able to survey thousands of people with just a couple clicks. And because of the way the filtering system works, where we can apply and remove filters, and that we can actually save the way we apply to remove those filters, we can bring that exact same cohort back up reliably as much as we want without having to resort or refilter things. So what we actually do is when we come up with a cohort we want to study, we actually give them a name, and then they get their own filter button. And then any of the analysts who want to look at that cohort from then on just have to hit that button, and they see everybody in the cohort without extra people or without having to remember any of the filters that were applied to get to them. So that really, as you can imagine, saves us a ton of time. And also, we're able to share those filters with other people. So if there's other analysts internally that want to do the same thing, we can share those filters with them if they have the same program, so that they can get the exact same results that we have. And it's also very easy then to take those cohorts and update them with new filters if we want to add additional things. And as you'll see with some of our internal initiatives, we were able to do that very easily, which really helped sort of speed up our workflow. Next slide, please. So originally what it was is this like transactional method, right? And this is probably what a lot of people are used to, where you create your scope of work and you detail it into it, you know, what you want and all the data points, and then how frequently you want it. And then you go and you ask your boss, like, is this okay? And he says yes or no. And then you meet with the subject matter experts and you talk about it a little bit more and try and figure out if these are the right data points, and you sort of refine it. And then you find out that you didn't have the right data points and you didn't really know what it actually meant in the first place. So you revise that and you rewrite the scope, and then you go back to your boss and go, you know what, this is really what I meant. And then when you're all done with that, you go to legal to see if you can actually share the information. And after all that's done, you get this large dump of data that you then have to clean and merge together, which takes a while and is probably the least fun part of my job. And then when all that's said and done, you can actually start beginning to analyze the data that you got. And you have to do that for each data source. So if you want to combine cross-systems data from 4 or 5 different places, it takes a very long time. So some of the projects we worked on before Forensic 360 were taking us 6, 7, 8 months. And a lot of that time was just waiting for things, waiting for approval. So this really eliminates a lot of that, a lot of the problems of a transactional method. Next slide, please. So what we moved to is more of an information sharing framework where there's MOUs in place that allow us to share some information. Now, what happened is the MOUs take a long time. So what we did is up at the prison, Dr. Bruce Herdman expanded the use of releases of information to include substance use and additional PHI information that wasn't covered in the MOU. And then we rigged it so that the data that flows into the enterprise data warehouse does not include people who refuse to sign the consent. And doing that allowed us to move forward very quickly with sharing of information. Now, once we were able to do that, the focus kind of shifted from how do we get this info to actually analyzing it, because we were able to skip all those other components of what we normally had to do. And then as a result of that, our meetings sort of changed in tone. They went from, well, how are we going to do this and what are we going to do, to, hey, this is what we're seeing from the data. What do we want to investigate further? What are you interested in? What would you like to know about this? Let's set some measurements. Let's set outcomes. And it's a very different type of meeting than we were having when we were still trying to figure out, what data we actually needed. And we could generate it much faster. So now, instead of turning things around in 6 or 8 months, we're turning them around in a week. And majority of that time spent actually analyzing the data and reviewing it with our managers, rather than trying to go through the process of even getting it. Next slide, please. Okay, so external utilization, possible applications. So as I said, Forensic 360 was originally designed for the Philadelphia Department of Prisons mental health provider. So they have a third-party contractor that does the mental health services. And what we found is that they were applying a serious mental illness flag to inmates based off a screening they were doing. Well, people present in very different ways and can present as having a serious mental illness when they've been using, or they're able to hide their mental illness. And so we found that the flag was good, but it could be better. So what we set out to do is get them information from our network so that they can make a more informed decision when they're diagnosing their patients. And what we could do with Forensic 360 is we were able to take and limit the access so that once a person's incarcerated, they can see the information, and once a person leaves incarceration, they can no longer see it. And that's really one of the big things that enabled us to move forward through the legal component. So that's one of the things we were working on currently. Our feature asks are, we're working on getting information in the hands of probation and parole. You have PO officers who, are working with individuals and really making treatment decisions on the fly without any context. And then also we want to get into the police department. We have crisis intervention trained officers who are made to respond to these special situations working with people with serious mental illness. And we want to help them make more informed decisions and refer them to some of the diversionary programs that we have available. Next slide, please. Okay, and finally, so here's how we've used it so far. Our Stepping Up initiative, we were able to pull a baseline cohort and analyze it. We've done 4 comparison cohorts so far, all the way from 2015 to 2019, some with 3 years of post-incarceration data and treatment utilization. The High Five initiative, where we actually used the Fuse model that they talked about a little bit earlier in this presentation. And what we were able to do there is, because they were such high utilizers and they went in and out of prison and they would disappear, we were able to use Forensic 360 to look and see where they were, because if they turned up in our system, we'd find them. And if they hit the prison system, we could find them as well. So it was a great way to sort of keep an eye on a really difficult cohort to pin down. And then the final thing is, we were able to take all of our initiatives and match them against the Stepping Up framework and look back and say, are our initiatives improving, the 4 pillars of the Stepping Up model? So it's really changed the way we've done business, and I can't stress it enough. And that's all I have. Thank you.
Great. Thank you both so much for the presentations and some of that background information on sort of how to get started. Really appreciate that. We have contact information for our speakers, as well as the folks who really help keep the trains moving on Stepping Up in Philadelphia up on the screen. Again, we will be sharing these slides and the recordings after the webinar up on the Stepping Up and the Data Driven Justice website, so please feel free to check those out. Also, I blasted out a little note to everybody as they were going through, just to make sure that everybody knows that in Pennsylvania they call them prisons, but they're really mean, for the rest of the country, they mean jails. So when they're saying prisons, they're really talking about their county-run jail there. So just to clarify, as folks are listening in. Okay, so I'm going to now introduce our second set of speakers who are from McLean County in Illinois. First, we have Tricia Malott, who is the Behavioral Health Coordinating Council Supervisor in the McLean County Administrator's Office. And in this role, she impacts systemic change related to behavioral health through collaboration and new and innovative programming. She's a licensed clinical social worker, and her clinical work includes working with children and adolescents impacted by trauma, sexual abuse, foster care, and the justice system, as well as adult survivors of sexual assault, those with severe and chronic mental illnesses, and specifically on women's issues as well. Her prior experience includes serving as the executive director for a community mental health program, and immediately prior to joining McLean County, she was the chief operating officer of a large multi-state group psychology practice. And then joining Ms. Malott is Camille Rodriguez, who's the county administrator for McLean County. And in this role, Ms. Rodriguez provides direction and leadership to 26 departments of the county government, while also serving the priorities for the 20 elected officials of the McLean County Board. So prior to this position, she served as the health department administrator for the county. She was a bureau director in the Division of Public Health at the Wisconsin Department of Health Services, and she also served a decade with the Illinois Department of Children and Family Services. So thank you both for joining us today. I'm going to go ahead and hand it over to you.
Thank you so much. This is Camille speaking. You can go ahead and move to the next slide. That would be great. I'd love to take this opportunity to say that Tricia and I today hope to share McLean County's path to addressing the behavioral health needs of our community. It's certainly still a journey. We have not arrived, but we know that some of what we tell you today might work for you. It might be part and parcel of your recipe. You might find some ingredients, but we know that our system that we have in place, it may not work for everyone, but we hope to share a little bit about us and about what we've done so far, and hope that you can take pieces of it and implement it or share it with your partners to have the successes that we have had. I also want to take this time to note that I've only recently become the county administrator, only just since June of this year. And with that said, I'd like to give a lot of credit to Mr. Bill Lawson, who retired at the end of May from the position of county administrator. It was his efforts, along with Chairman of the McLean County Board, John McIntyre, and also one of the members. All of the members were very supportive, but member Susan Schaefer of the county board as well. If it weren't for the efforts of those three and the support of the entire McLean County board, our government and our systems would not be where they are today. And in fact, even when I started at the end of 2017, beginning of 2018 with McLean County government, coming from Wisconsin, Tricia's position as Behavioral Health Coordinating Council Supervisor was just a vision in someone's mind. It hadn't come to fruition just yet. So we've done a lot in the last few years, but it couldn't have been done without Bill Lawson, Susan Schaefer, John McIntyre, and the board. With that said, a little bit about us really quickly. McLean County, Illinois, is geographically the largest county in central Illinois. We are located about 2 hours southwest of Chicago, about 3 hours directly south of Madison, Wisconsin, or about 3 hours east of St. Louis. I don't know my directions very well. We're about 175,000 strong in the entire county. We are the home of Illinois State University, Wesleyan University. If you've heard of State Farm, this is its headquarters. We are also newly visited by a place called Rivian Electric Motors, and they are going to build electric trucks here. We are on the I-39-94-55 corridor. I bring all that to your attention because sometimes our place in space brings blessings and challenges, and some of those challenges for us included we needed to understand what the needs were of our behavioral health, of our folks that need behavioral health services who also intersect with the justice system. We wanted to know how we could convene and collaborate, especially in an environment in county government that often has limited resources but a lot of established need, and especially when those in need require a lot of intensive care management or housing. Please move to the next slide. So in 2013, as you can see from the slide, I don't like to read slides to you, but the National Institute of Corrections studied our systems. And to that end, I feel like it's the proper time then to say our McLean County Board decided to walk the talk. They decided to get together and talk about the mental health needs of our community, and they worked for over a year and a half, if not more, to create a product called our McLean County Mental Health Action Plan. In that plan, it provided actionable items for the entire community, let alone McLean County government. And it also raised awareness of our need to create community support for the construction of an addition to our McLean County Detention Facility, or also you could call it our jail, to provide specialized units for housing individuals who happen to have behavioral health issues. I'm proud to fast forward and say that that is open now. And we are providing services to individuals in that facility in a different way than we used to in the past. But I bring all of these issues up because it was imperative for us as a county government to have a county board who did walk the talk. That they did that as well when they passed a resolution in June of 2015 to be a member of the Stepping Up Initiative, and again later this year when we declared May through a county board proclamation as Stepping Up Month and Mental Health Action Month. And so these are just some of the organic and easy ways, I would say, that our county government has stepped up to show support for behavioral health initiatives. I'll have to add that it wasn't easy to build an addition to our detention facility, but some of the other smaller ways that they show their support through resolutions and proclamations is absolutely helpful. And ultimately, we've taken other steps since then to address the needs of people with behavioral health issues, especially post-arrest, because we don't want them to come back into our facilities. We want to intercept them early. We want to make sure that they stay a vital part of our community, and that's some of the things we're going to explain to you throughout the rest of the presentation. Next slide, please. So some of the other ways that we have been working to address our behavioral health needs in McLean County include some of our data-driven initiatives. So we were one of the first 20 jurisdictions invited to participate in the White House Data-Driven Justice Initiative back in January of 2016. After that, McLean County did participate as a presenter and brought a team to attend the Illinois Data-Driven Justice and Health Forum. And as a result, our work on data analysis and research with the Illinois State University Stevenson Center has been really paramount in all of this work. That was supported by our formation of our McLean County Criminal Justice Coordinating Council, as initiated by that Mental Health Action Plan I was telling you about. You should also know that in other ways where we knew people who happened to be intersecting with the criminal justice system and behavioral health systems were not seeing a lot of success was with housing. So we did get a grant with the Corporation for Supportive Housing, and that's been also a part of our efforts. And we also have worked with partners like what was called the Laura and John Arnold Foundation, but now Arnold Ventures, to develop data sharing capabilities and working on housing and homeless data. So that's been a part of what we have been working on as well. The other thing I'll add is, you know how I said in the beginning when I was introducing ourselves, and I said, you know, our recipe has led to this. Part of our recipe is that we utilize a very robust criminal justice information system. It's fully integrated. We have real-time access to police, court, jail, and probation information for all members of this system. It helps us collaborate every day on a working level. It allows the Stevenson Center and other partners to use our data to provide analysis and give us the information we need to make data-driven decisions about the next steps within our current systems or within future grant or other program opportunities. And we do have mental health indicators inside that justice system. So it is one of the most integrated justice systems in the country, and we're happy to talk to any of you about it individually in the coming days if you're interested. Next slide, please. So as I mentioned, we have all of this data, and what do we do with it to measure our challenges and to make decisions? Our large database from this justice system that I mentioned captures each person with a unique identifier. It helps us capture all the person's contacts with the justice system, and that allows places like the Stevenson Center to give us an analysis of recidivism, case processing time, type and severity of arrests, and whether or not we're serving and supporting people who happen to have a mental illness. This data has told us and continues to tell us that there is a growing number of individuals within our community that enter the justice system who happen to have a mental illness and or a substance abuse addiction. And they also end up representing a large part of the jail population. We want to intersect. We want to be able to provide services that either can keep these individuals out of the jail or serve them well so that when they come out, they have the services and supports that they need in McLean County. This has really been an effort of so many people in the community. We mentioned the Behavioral Health Coordinating Council, and that an effort of the McLean County Board to convene CEOs and not-for-profits and hospitals. Those representatives from our community convene regularly to discuss the challenges faced by all of us trying to provide behavioral health services in this community. But raising the awareness is part and parcel of those efforts, and we really believe that the efforts have led to not only the continuation of our enhanced justice system, information system, and the collaborations with the Stevenson Center, but also enhanced training to our law enforcement officers and to our service providers who meet up with all of these individuals in times of crisis. We've also developed specialty courts, and we're continuing to work to identify gaps in services in our community. And I think Trish is going to talk more about some of the services that we're in the process of implementing as a result of those identifications of gaps in services. Tricia, I turn it over to you.
Next slide, please. So one of the key pieces for data and how we've moved forward with some programming is a data integration tool that evaluates our justice and our housing data. And Camille mentioned some of our partnerships, and this tool came out of those partnerships with the Corporation for Supportive Housing, the University of Chicago Center for Data Science and Public Policy, as well as Arnold Ventures. And McLean County was one of 4 communities selected for a technical assistance grant for scaling data integration, advancing pay for success systems change in support of housing for vulnerable justice-involved populations. And with that, we have the ability to look at approximately 20 years of our justice data. And again, because we have such a comprehensive, robust justice system, we not only have a lot of the information, but it's also a little bit easier for us to capture that because it's all in one system rather than pulling from different systems. And we also have more than 5 years of data on our shelter usage through our homeless management information system, which is managed by our local continuum of care provider. And when we look at that intersection, we are able to see individuals and their number of shelter contacts, shelter bed days, number of jail contacts and jail bed days, as well as total contacts and whether they have ever been indicated for a mental health need in our justice system. From that, we have then been able to look at how we can serve that and what the trends are. Our long-term goal is to look more toward predictive analytics. In the short term, it is to implement a FUSE program. Next slide. So FUSE, for the folks who may not be familiar, is a Corporation for Supportive Housing signature initiative, which is designed to help break the cycle of homelessness and crisis among individuals with complex needs. One of the things that is unique about FUSE is that it can vary by community, and it has some core guiding principles where the individuals may be justice involved, have health needs, or a combination of those two. And all have the consistent need of needing supports with housing. For McLean County, our FUSE program is designed to address all of those, and that's where that tool created in partnership with CSH and the University of Chicago comes into play. And so we use that information to then do outreach to our highest utilizers, and we look at an 18-month period to identify those who have had the most contact across at least those two systems. And I'll get into a little bit about what our data shows us and what it does not, and how we try to overcome the barriers that we have. We do know that the research shows that the more we can connect individuals with stable housing, the better outcomes for justice involvement, physical health outcomes, as well as mental health outcomes. For our services, they are intensive case management that includes housing supports, employment supports, daily case management and contact, including medication distribution and psychiatric care, as well as our staff being on call 24 hours a day to maintain continuity for one team responding to their needs. Next slide. This slide shows the FUSE roadmap as outlined by CSH, and I include it here to identify sort of where we've been and where we are and where we're going, because it's something that not just that CSH has come up with, but that we also live and breathe as a county. And so we are currently in that middle section where we are we have identified our outcome measures and what they will be, but we also know what our long-term outcome measures are that we hope to accomplish. And so it's not just reducing emergency department visits and jail bed days and shelter days, but long-term, we want to be able to measure and see change with regard to improved behavioral health and physical health outcomes. And so not just where we're intersecting them at the beginning, but how are we improving lives overall? And then we're doing intensive outreach to the individuals that have been identified through our tool. And my description to people who aren't familiar with what that looks like is instead of what you might imagine as a cold call, it is a cold face-to-face, because sometimes you don't know what the person looks like and they may not have heard of FUSE. But you are going out into the community and meeting them where they are to talk to them about the benefits of one team serving their needs rather than having fragmented services throughout the community. And then for the future for us, we intend to scale the model each year to add participants to the FUSE program who are being served, and for a number of purposes, one of which is to open up capacity at lower levels of care for our other community service providers, so that as we take on the higher need, higher cost individuals, that it allows our other community service providers to take on individuals who may have lower needs and see more of them. In addition, we hope to be able to provide proof of concept to be able to fully implement a pay-for-success model. Next slide. So what does our data look like? I talked about the actual intersection when we use the data matching tool, but then in real terms of what we do with that, it then gets sorted so that for our service provision, we're identifying those with a mental health indicator. But then we're looking at who has had the most contacts across at least 2 systems, and then the most recent shelter contact. One of the things that I have noticed over the past probably about 9 months as I continue to look at our top utilizers each month is that our top 20 consistently have 8 or more total contacts between the 2 systems in an 18-month period. Most of those individuals are under the age of 40. And I don't have the statistic with me, but an overwhelming majority of them have actually been individuals in their 20s. And so as I've done some community dialogue about our FUSE program, that has been one piece that has been surprising to people, because there are a lot of stereotypes about who homeless individuals are. And that's the other thing that our data can do, is it can help us better inform our communities about what homelessness really does look like, who is in need of services, so that we better connect them. Most of our matches in that intersection with the tool have also consistently remained in the top 20. While their placement has varied at times, most of them have remained in the top 20 regardless of which month I run the intersection. And it's only been recently that we've started to see some new names in there. Next slide. Some things that our data does not show, or that we don't have health data. So we do not have business associate agreements or confidentiality agreements with either of our local hospitals or with many of our service providers. We are in Illinois. The Illinois mental health statute is actually more limiting than HIPAA. And so while many service providers will often cite HIPAA as a reason to not share data, in Illinois, it is actually our mental health code that plays a bigger part in whether information can be shared or not. And so there are definitely some hurdles to be able to overcome that, though we do continue to have dialogue with our partnered healthcare providers as well as our hospitals to try to engage them in the possibility of a BAA or a confidentiality agreement, so that we can better have that data to produce better outcomes. As a result, that also means we don't have diagnostic information on individuals. We do not have EMS transports or 911 calls. We also don't have current location or current service involvement. And so when I described what our FUSE program looks like in our outreach, that also plays a part in that we don't necessarily know where to look for people, because while we can identify that someone's last shelter contact may have been 2 weeks ago, we may not necessarily know which shelter or where they've been since. Next slide. So when we begin to overcome our data challenges, we have tried to figure out how we can still get some of the information that we want or need. So we have, for FUSE in particular, we have our participants sign releases or exchanges of information so that we can acquire their health data after, because we still want to track outcome measures for emergency department visits and relevant health metrics. And so being able to identify the success of a program and how we're intervening that justice involved and behavioral health overlap in our community is is important, and so we are finding ways to be able to get that information. We're also building partnerships and relationships. Those relationships are also what help facilitate MOUs, BAAs, and confidentiality agreements becoming signed. And we provide information and referral forms. So we find that the more people know, the better they can connect individuals that they're serving to the programs that we're providing. And we continuously seek new ways to integrate data. So that may be through new systems and platforms, learning from other jurisdictions about how they're integrating data, how are other people overcoming challenges, and trying to think outside of the box. So how else can we acquire data or overcome that hurdle while still being legal and ethical and following everything that we need to and still trying to meet our end goals. Next slide. We also continue to use data to meet the needs of the justice involved with behavioral health concerns for that, not only for the Stepping Up initiative, but because it has been an identified priority for the county as a whole. And we have tried to look at, one, where our service provision is, and also where we can intercept at an earlier point to try to stop people from entering the justice system when the real need or the real concern is a behavioral health concern. And so we are in the process of implementing a triage center, which serves as the missing puzzle piece to our community's crisis continuum. We have had a crisis hotline, we have a mobile crisis team, we have emergency departments, and we have the jail, which serves as an unfortunate option, but we have not had a 24-hour walk-in facility. We also have not had a diversion option from the justice system, and that's part of what the triage center will do. It will provide law enforcement the option to drop an individual off for assessment and linkage to the appropriate level of care and community resources, rather than entering into the justice system or the emergency department when those are not the two most appropriate places for an individual. We are also working toward having the same prescriber for our inmates as well as for our FUSE program, knowing that there's so much overlap and that the better continuity of care we can provide means that we can reduce recidivism rates when it's related to mental health. And by doing so, we also then have additional information and better data on those people so that we can look at what the future can be. We have also partnered with NYU Criminal Justice Lab on a pilot project for a law enforcement screening tool to assess for mental health, homelessness, and substance use concerns, with the idea that if validated, becomes an available tool to law enforcement in the field so that they know the most appropriate place to take an individual, be it involvement in the justice system or the hospital or a diversion option like the triage center or a living room model. And we know that this is a critical piece in future data collection and future data sharing. We also were recently a recipient of a Bureau of Justice Assistance grant award for their collaborative justice and mental health program to establish a comprehensive assessment team for youth and adolescents who have justice contact for high-risk youth. And so the goal of that is to be able to create a systemic change to service provision and how providers communicate and care for those high-risk youth, with the idea that when we intervene and treat and intercept earlier, then we can prevent adult justice contact and hopefully not have them enter into a program like the FUSE program. Next slide. And when we consider what other jurisdictions may find helpful as they may be getting started or in the middle of any of this, you know, Camille started with identifying the significance of our former county administrator and current chair of the county board and Ms. Schaefer and other county board members, but leadership buy-in, I would say, is crucial. Our steps for involvement with DDJ and the Stepping Up Initiative and our own county mental health action plan really has started with leadership of the county in the administrator's office, both present and past chair of the county board, our entire county board, as well as leaders of our local municipalities. And so having their support and their effort to move forward is crucial, as well as establishing partnerships. For us, it's through the Criminal Justice Coordinating Council, the Behavioral Health Coordinating Council, and our Juvenile Justice Council, and being able to bring public and private entities together to create solutions, and framing it that way that it is for problem solving and how to move forward. Building relationships with funding partners, business leaders in your community, and research bodies. That's one of the things that we have continued to do, is we strive to maintain contact with all of those entities over time, and continuing to evaluate your data. So what data do you have, even if it's not ideal or complete or robust? What data do you have? Can you acquire new data? And what does the data tell you? Where do you need to go with it? And being strategic about where you want to go, and recognizing that it doesn't happen overnight. Camille outlined a little bit about our history, and where we've gone in 4 years is huge. And at the same time, I know for other people with the county who have been part of the county structure for a lot longer than I have, 4 years also feels like a really long time. But all of the steps along the way have led to where we are now. And that's it for us.
Great. Thank you both so much for the presentation. So 2 different ways that counties are sort of handling this, and really appreciate you guys sharing some of the work you're doing and where some of those challenges exist. So we've gotten dozens of questions, and we only technically have 2 minutes left in this webinar. We're not going to get to all of your questions. We will take a couple right now, but we will email the speakers with your questions and let them get in touch with you, or you can email the speakers directly if you'd like. You have their contact information to get more information on some of these. One question that was asked by 3 different people, so I am going to ask this one on here, is around consent and consent forms. So I don't know, maybe we'll have the Philly people go first, but can you talk a little bit about how you guys handle consent, how long the consent forms are for, what happens if they change their mind? Just talk a little bit about that consent process, please.
Yeah, sure. Essentially what we do is we decide what information we need or want to share, and then we push everything through city law. And they make the decision of what's appropriate to be on that consent form, what does it actually cover, how long does it last for, how can we implement it. So really we didn't have much to do with it. It was a lot more of here's what we want, and then collaborating with the attorneys on getting an appropriate form that was approved, and also making sure that it was initiative specific. So each one of our initiatives that we do something like that for, we run through city law to get approval for that exact form.
Okay. Folks in McLean County, do you want to talk about your process there?
So I conceptualize this answer in 2 different ways. On a specific program level, participants and individuals would sign a consent for treatment, but also a release or an exchange of information to any other entity that we might be sharing information with. And we have them sign for 1 year unless they specify differently. And that's on an individual level. With regard to our justice data, that's county data that we already have. For our HMIS data for our tool is part of a data sharing agreement with our continuum of care provider who maintains that. And that is already in existence. I will say on their end, if they have individuals on their continuum of care list that may cross over into one of our programs, then that is also a release of information signed at the individual level.
Okay, great. Would either or both of you be willing to share your consent forms? I have a feeling some folks have already asked if they could see them. They might email you directly to see your consent forms if that's something you're willing to share.
Yeah, of course.
Sure. Great, thank you. And then we had some questions for McLean County about your triage center. How is it funded? And then was there any conversation around transporting people to the triage center if the person's not on a legal hold? And that's sort of specific questions.
Yeah, so starting with funding, in 2016, McLean County, along with the City of Bloomington and the Town of Normal, entered into an intergovernmental agreement for a public safety and mental health fund, which was, it allows for a portion of a sales tax increase in the city and the town to be allocated to specific funding that the county manages. And that is part of what has provided for additional services for behavioral health in our detention facility, and also provide a lot of the funding for some of the programs that I talked about as well. So that is the original funding for the triage center, although we will also be billing for Medicaid and insurance for crisis services as appropriate, while also not turning anyone away if they don't have insurance. With regard to transportation and a hold, we've had multiple meetings with our with law enforcement, so with our sheriff and with our police chiefs, about what the triage center would be, about it serving as a diversion option, and it is voluntary. And so if an officer has contact with an individual and they believe that they would be appropriate for the triage center, they can give the individual the option to go there, and they will be transported by law enforcement, and there's a handoff process. But the idea is also to get law enforcement back out into the field as quickly as possible, so that their total time is spent more in the field rather than in an emergency department or even in booking in the jail. Great.
Thank you very much. Okay, last question really quick for Philadelphia. Is the information that you guys are receiving and using as part of it, are you getting that in real time?
Well, you know, there's real time, and then there's data that is timely enough to make decisions. So the thing is to create the 360 in a way that's really useful for the business, for Charles and his team. We get the data loaded from all of the different sources every night, and then it's refreshed and made available the next day. So that's way better than when we got the data once a month. So it's much closer to real time. But the reality is Philadelphia spends money on technology, but then again, we don't overspend. So we are not running a bank. So we don't need to keep track of things the same way that a bank does. So people don't overdraw by going to ATMs all the way down the street. So what we found is this is a good enough solution so we can make timely decisions with data that is extremely current.
And if you think about it this way as well, our Medicaid providers have 90 days to submit their claims to the managed care provider anyway. So even if it's real time, some of that data just isn't available because the sources haven't collected it or entered it yet.
Got it. Okay, great. Thank you, guys. We are definitely over time. I want to do some really quick polling questions so we can know who is on the line. We had about 500 people join us on the line here, so thank you guys for joining. Why don't we launch the first poll while I give you a little bit more information on what's coming up next. So for those of you, so go ahead and start filling out those polls, and I'm just going to talk over them. So we're interested in hearing, who is on the line today, your county elected official, administrator, whether you work for a health, human services, social services agency, you're with law enforcement or corrections, or you're with the state. Great, thank you. Let's go to the second poll, please. Wonderful, and we'd love to know where you are. Are you consider yourself a rural county, a mid-sized county, a large urban county, or are you with the state agency, or are you sort of unsure? Probably a few of you kind of know a little bit about what your neighborhood looks like there. All right, let's go to the third poll. Great. So for this one, we want to know if you are part of a county that has passed a stepping up resolution. Remember, I said at the beginning of the call, we've had about 500 counties that have passed a stepping up resolution. We are continuing to get more and more every week. We'd love to have you join us. If you're unsure, it looks like a third of you are unsure. If you go to the Stepping Up website, so stepuptogether.org, and you go to the tab that says the counties, and it'll say, I think, county resolutions, you can see a list by state of all of the counties that have passed a resolution. So if you go there and see if your county is on that list, and if it's not on that list, on that same website, you can download a template resolution where you can go take that to your county board of commissioners or supervisors and ask them to join the Stepping Up initiative, and then send that back to us so we can get you up on the map and make sure you're getting all of the resources. We've got about 40% of folks on the phone who have joined so far, and about a third of you said unsure. So want to make sure you get that information. All right, final poll. And this one, are you a data-driven justice member? So for this one, if you are not sure or if you want to join, so you can go to the Data-Driven Justice website, so naco.org/data-driven-justice, and I'm going to put those websites up there. And check and see, there's a whole list of all of the cities, counties, and states that have joined Data-Driven Justice. Also on that website is all of the resources that we talked about, but you can also download a template of the letter of interest that you need to submit in order to become a Data-Driven Justice community. So we hope folks will go check out that tool as well. Thank you for participating in all the polling. As you can see up here, this is the first of two webinars that we're going to do around this topic. The next one will be on Thursday, December 5th at 2 o'clock Eastern Time, and we're going to talk about strategies for identifying and serving frequent utilizers of health, human services, and justice systems. You can register via the links that you see up there. It should also be a link in your follow-up email to register for those. Here's all the contact information for the two initiatives, for Stepping Up and for Data-Driven Justice. Please reach out to us if you have any questions about the initiative, or we can be helpful in any way. I would also recommend to everyone who's really interested in this topic that you sign up for both of the email lists. So if you want to sign up for the Stepping Up email list, go to stepuptogether.org. Click on the red Take Action button and then fill out that form so you'll get added to the email list. And then for Data-Driven Justice, you go to the DDJ website, so naco.org/data-driven-justice, and fill out the contact form that you'll see on that screen. If you have participated in a DDJ webinar in the past, you should have received an email from Sharon Ondeji this week about a contact form for you all to fill out. So it might be in your spam folder. Go check in there for an email from Sharon, and please go ahead and fill that out so you all can stay connected. All right, that's the end. We've gone way over time. Thank you all so much for joining us again. Thank you for your participation, your questions. Thank you so much to our speakers for taking the time to be with us today, and we hope to have you on future Stepping Up and DDJ webinars in the future. Have a great day.